I am very pleased to be the spokesperson for all political parties, since we have reached a consensus on this topic.
Over 2/3 of Canadians have private insurance for drugs, physiotherapy, dentistry, etc. Why doesn't everyone?
Well, I just don't agree with it. We should all be equal.
Don't you have private insurance?
Well, yes, but I just I would eliminate the role of private insurance for those services and make them government-operated. Then we could have 6-month waits to see a dentist or pharmacist or physiotherapist, just like the other services under Medicare. And people could just make do with cheaper, less effective drugs.
Should government access your medical records without your consent?
Well, of course. We need to know whether you are abusing our government system.
But you don't even ask permission.
Well, it's a public system, and the public has a right to know where their money is going.
But why don't you inform people when you look at their records?
We consider them as government records, not yours.
The Supreme Court of Canada has granted Quebec citizens suffering on wait lists the right to buy private insurance and get treatment quickly. Shouldn't citizens from other provinces have the same rights as Quebecers?
Absolutely not. Waiting for health care, and having patients suffer and die on wait lists, is a defining feature of our nationhood. How could we define ourselves if there were no wait lists? Quebec is a distinct society, and most of them speak French.
Workers' compensation patients, RCMP, and even prisoners are treated faster in the private sector. Why not give all citizens that right?
Well, that's a really good question. It is showing up our system for what it is. It's not good that people can see that our government plan is inferior. Maybe we should make it illegal for those groups as well, so they have to wait in line like the rest of you. Oops, sorry, I meant the rest of us.
Our health system ranks 30th in the world, yet we are one of those that spend the most. What's your view on that?
Here are 196 countries on Earth, so 30th isn't bad. We rank even lower in soccer, and lower still in cricket. People should appreciate what they have. If we ranked near the top, we could only go down.
Can't we learn from European countries, such as France, Austria, Belgium, Germany, Switzerland, and many others that have universal access and no waits in their public systems?
Absolutely not. We should never compare ourselves to countries that do better than us, and especially when they spend less money. It makes Canada, and the way we manage our health system, look bad. We need to compare ourselves to countries that do worse than we do. That way we look better.
The main health determinants are poverty, housing and nutrition. Should government therefore control these and eliminate the private sector from their role in those services?
Yes, that's a very sensible suggestion. I think we should have the state take over our grocery stores. We should eliminate private home ownership. By eliminating profits and competition, we will save billions. Since poverty is the main factor that determines health status, we should bring in compulsory equal wages for all. That way we will all be equal.
Physician and hospital services are government monopolies. Do monopolies ever favor consumers?
Absolutely. Thanks to competition, people are overusing resources and technology, and wasting a lot of time. When there was only a single government TV channel, less people wasted time watching TV. When there was only a single telephone company, people did not waste time on the phone, because it was too expensive. Choice leads to people dithering and having to make personal decisions that may not be in their best interest. Politicians are better equipped to make decisions, because we are smarter than the public. The unsustainable increases in health costs that we have overseen, the withdrawal of funding from other vital services like education, and the debt load legacy to our children are examples of our successful plan to mortgage the future of our children and grandchildren. Besides, we will be out of office and retired on our big pensions by the time anyone notices.
If your loved one is on a 12-month wait list for treatment, would you pay to get care sooner?
No, that is a waste of money. It is character building to suffer in pain. Makes one tough and strong and better equipped to cope. Besides, people on wait lists for treatment can be very productive members of society. They can watch our parliament on TV, or if waiting for a cataract operation, listen on the radio, and make valuable suggestions to government. There are many university researchers in Canada who study wait lists. It would be unfair to allow the queues to shorten with private care. The researchers would observe the absence of wait lists in the private system, and it would make the public system look as bad as it is. If the public system improved, the wait list researchers would have no research to do.
You are free to spend your money on alcohol, smoking, gambling, pornography, and on the care of your pets. Why not on the health care of one's family?
That's a very good question. It's a very good question indeed, and thank you for asking it. Perhaps the cure for gambling, tobacco, and other vices is, like health care, to make them exclusively available from government. That will ensure they will be in short supply and citizens will benefit by reduced access to these vices. Thank you for that inspirational, thought-provoking question.
Surely the fact that Canada has 14 ministries of health, each with deputies, associate deputies, assistant deputies, etc. is ridiculous, when France, with twice the population, has just one health minister? Do you think the system is wasteful when we have one health bureaucrat for every 1,400 citizens, while Germany has one for every 15,000? Shouldn't we reduce our numbers?
Not at all. Government has an important role in job creation. Without adequate administration, the system would be in chaos and the public would have to have some responsibility for their own health and wellness. Also, now that we have so many administrators, there is no mechanism to reduce them. Surely, you can't honestly expect an administrator to administer themselves out of a job in administration? That could never happen.
No, I guess not. Stupid of me. I thought we might be able to use some administrative funding to hire more front-line workers, including nurses and doctors. I realize how silly the thought is. I want to thank you for your frank, open and informative answers. I have learned a lot, and I think I understand.
You are welcome. I am glad you understand how we think and how we work.